Everybody, this is Dr. Kamel again, and a new content related to the physical therapy license exam. If you didn't see any of my videos before, I am, doing some videos related to the preparation for physical therapy license exam in United States, in Canada, and also in Australia. So let's go and see what is today's content is about. While working in a private practice clinic, a physical therapist observes a patient fall in the parking lot outside the office. So you are inside the clinic and you are seeing a patient falling in the parking lot outside the office, not inside the office. The patient sustains a severe laceration to the forearm. So injury happened. So accident and injury happened. The therapist secures a pressure dressings to the wound site, but notes that blood is soaking through the dressing and the bandage. Okay. So, the therapist is trying to stop the blood by applying pressure, okay, to this dressing wound and wound site by applying dressing with pressure, but still blood is soaking. Which of the following actions should the therapist perform next? Number one, elevate the limb and apply pressure to the wound. Number two, remove the dressing and bandage and start over with a tighter bandage. Number three, apply additional dressings and bandage and apply pressure to the brachial artery. Number four, call the patient's physician, arrange transportation for medical care. I think the last one is the least one I would think about, because this is not the time for calling physician and stuff. You are in an emergency situation and you have to act quickly and safely at the same time. So what is the correct answer for this question? The correct answer is number three, apply additional dressings and bandages and apply pressure to the brachial artery. Okay, so let's think about this question and analyze this question. What is this question is about? This question is testing your emergency management of external hemorrhage. How would you deal with this situation? Number two, first aid priorities. So which one you would do first, which one you would do next. Clinical decision making sequence. What would you do in this situation? This is an emergency situation. I would wait and calling the physician and stuff, or I would act. And so decision making is important here. Number four, recognition of severe arterial bleeding, because we know that arterial bleeding is different from venous bleeding. Arterial bleeding is usually massive, pulsating. There will be more blood loss. Okay. So the key phrase in this question is blood is soaking through the dressing and the bandage. Okay. So this means that this direct pressure, which is a physical therapist applied, was not sufficient. This is number one. Number two, bleeding is likely severe arterial or uncontrolled venous bleeding, but it's mostly more arterial. Number three, immediate escalation of hemorrhage control is required. We have to do something. We cannot leave it as it is. Okay. So what is the next intervention in this situation after you started with applying dressing, applying pressure, and still is not working hard 100%? What you should do? Okay. So when this bleeding continues through the original dressing, what I should do here? So we need to understand the sequence of dealing with bleeding, or the standard emergency bleeding control sequence. Number one is direct pressure, and the therapist did that, but it might be, in this situation, the therapist need to apply more pressure. Number two, reinforce dressing. Okay, so we have a soaked dressing already with blood. Should we remove it, which will result in more bleeding actually, or we should reinforce dressing without removing this soaked dressing. Number three, apply pressure to proximal pressure artery, which is in this situation the brachial artery. Okay. Number four, elevate the limb if appropriate in order so the blood will be moving against gravity and this will reduce bleeding. Number five, emergency medical activation. This is a last resort if nothing is working. So because the wound is on the forearm, the proximal arterial pressure point is brachial artery. So it is logic that you apply pressure to the brachial artery. So applying pressure there in this point on the brachial artery will reduce distal blood flow to the injury site, which will help to reduce blood loss. Okay, and in this situation, we are learning an important clinical principle. When blood soaks through, don't remove the original dressing. Don't remove the original dressing. Okay, we will apply or add more dressing on the top of the one which is already there and maintain continuous pressure. Okay, and so removing the dressing actually will disrupt clot formation because we have initial clot formation which starts to form. So if you remove this initial dressing, you are actually disrupting this clot formation, and which will result in worsening of the bleeding. Okay, so this was the correct answer. Let's look at the incorrect options. Number one, elevate the limb and apply pressure to the wound. Okay, yeah, but this is correct, but this is not the best next action in this situation. Okay, as a pressure, the therapist already applied some direct pressure. Okay, and secures a pressure dressing already there in on the wound, and still bleeding remains uncontrolled. Okay, so I need to do something else. There is more aggressive hemorrhage control is needed, and I need to apply pressure to the proximal artery, which is here the brachial artery. So for the NBT or the exam or physical therapy license exam, elevation alone is not sufficient, okay, and will be less effective in case of severe hemorrhage like in this question, okay, and considering secondary to direct pressure and arterial compression. So this answer is incomplete. It is correct, but it is incomplete. Option number two, remove the dressing and bend it. No, this cannot be happening because we will disrupt the already initial clot formation and start over with a tighter bandage. It is incorrect and potentially dangerous. Removing this dressing will disrupt clot formation and removes early platelet aggregation, which is happening, and this will worsen the bleeding actually, or restart the bleeding again. Okay, so again, correct first aid principle. If the blood is soaking, like in this situation, leave the original dressing in place, add additional layers, but don't remove it. Okay, so never remove saturated dressing unless medical personnel are performing wound exploration and seeing if there is any stitches needing, or if needed, or if anything else would be applied, and this dressing must be replaced under sterile management in order to avoid the induction of any infection or to the wound. Option number four, call the physician and arrange transportation. This is the least or the worst option, as this will delay urgent hemorrhage management. So severe bleeding is a medical emergency and it has to managed immediately with hemorrhage control first. So we need to apply the ABCs and bleeding control principles. Notifying the physician is appropriate, but later on, not the initial action. And uncontrolled bleeding, have to be stopped first. And if nothing is working, I have to call the emergency and depending on severity, but I will not wait until the patient, physician, and stuff, and this is not the correct option. So for the license exam, when you see a question like this and you are faced with an active bleeding situation, airway compression, or airway compromise, cardiac arrest, neurologic emergency, the therapist must work to stabilize the emergency situation first and then activate the emergency response, call 911, or do call the emergency response, then arrange for medical follow-up. This should be the steps. You should act first as a therapist. Okay, so again, in order to control this bleeding, number one, direct pressure. Number two, pressure dressing. Number three, additional dressing if soaked. Number four, pressure to the proximal artery in this situation, because it is in around the forearm, so brachial artery is the proximal artery. Number five, elevation is a secondary measure. Number six, applying tourniquet only for life-threatening uncontrolled extremity hemorrhage, which like a pressure bandage. Okay, so if finally, these are the rules. Don't remove the dressing. You can add additional dressing. You can maintain direct pressure. You apply pressure to the proximal artery if bleeding persists. Okay, and the proximal pressure point here is the brachial artery. Elevation is correct, we said, but it is not, the next correct next step for this uncontrolled bleeding. And removal of dressing and bandage would irritate the wound and increase the hemorrhage. Elevation and pressure should be applied first before additional dressing, bandage and pressure to the brachial artery. And this is the answer for this question. If you would like to join my physical therapy license exam preparation course, please send me a message on these WhatsApp numbers 0014422487206 or 00201027743702. I will send you the details for joining my course. You can I also try to facilitate the situation for people who cannot afford joining the course by being on installments, so they don't have to pay the full amount upfront before joining my course. Please encourage people to join my YouTube channel, and either colleagues, students, or graduates, physical therapy graduates. And thanks so much for watching me. See you very soon in a new content. Thank you.